Everyone, I'm from EAC News, reporting live here at the beautiful Soka Hotel in Phnom Penh, Cambodia. Today is an important day, February 20th, 2025, as we gather for the opening ceremony of the much-anticipated Cambodia Social Protection Week 2025, alongside the official launch of the National Social Protection Policy Framework 2024 to 2035. As we stand here, you can feel the atmosphere charged with energy and anticipation. This event marks a significant milestone in Cambodia's ongoing efforts to develop a robust social protection system for its citizens. Over the next 2 days, this event will serve as a crucial forum for stakeholders, including government officials, development partners, civil society, and the private sector, to engage in vital discussions about social protection policies. The theme for this year is developing Cambodia's social protection system through a life cycle risks approach toward better coverage. This theme aims to address the diverse needs of citizens throughout their life cycles, highlighting that social protection should start from the moment of birth and extend through various life stages. We are honored to have dignitaries in attendance, including His Excellency Aun Pornmonirath, the Deputy Prime Minister and Minister of the Ministry of Economy and Finance, who will deliver welcoming remarks shortly. It's worth noting that we also expect Samdech Mohaborverthapadiai Hun Maneth, Prime Minister of the Kingdom of Cambodia, to speak during this event. The Prime Minister is expected to address several critical points in his speech today. First, he will emphasize the importance of social protection as a fundamental right for all citizens, affirming the government's commitment to ensuring that vulnerable populations are adequately supported. He will also discuss the key achievements made under the previous National Social Protection Policy Framework and highlight the importance of building on this foundation moving forward. Specifically, he will underscore the government's determination to shift from a pillar-based approach to a life cycle risks perspective, allowing for more comprehensive and inclusive protections for all Cambodians. Additionally, the Prime Minister will likely elaborate on the government's strategies to expand coverage for national social assistance programs and social security schemes, with a focus on innovative approaches to target those most in need, including women, children, the elderly, and persons with disabilities. He is also expected to announce plans for the introduction of new programs aimed at enhancing social safety nets, which will be particularly crucial in light of recent challenges such as the COVID-19 pandemic and economic uncertainties. This includes special funding allocations for emergency responses to support poor and vulnerable households during crises. Moreover, the Prime Minister will
រាជរដ្ឋាភិបាលក្រោមការដឹកនាំរបស់សម្ដេចមហាបវរធិបតីហ៊ុនម៉ាណែតនាយករដ្ឋមន្ត្រីនៃព្រះរាជាណាចក្រកម្ពុជាបានយកចិត្តទុកដាក់ខ្ពស់នៅក្នុងការអភិវឌ្ឍមូលធនមនុស្សផ្ដល់ប្រាក់ឧបត្ថម្ភថែទាំសុខភាពនិងបណ្ដុះបណ្ដាលជំនាញវិជ្ជាជីវៈជូនដល់ពលរដ្ឋដែលជាសមាជិកបសសគ្រួសារងាយរងហានិភ័យគ្រួសារក្រីក្រនិងក្រុមគោលដៅផ្សេងៗមួយចំនួនទៀតពលរដ្ឋដែលកំពុងទទួលបានកិច្ចគាំពៀបានបង្ហាញសេចក្តីរីករាយនិងពេញចិត្តជាខ្លាំងចំពោះការយកចិត្តទុកដាក់របស់រាជរដ្ឋាភិបាលខ្ញុំសប្បាយចិត្តណាស់បានផ្ដល់ឲ្យលុយខ្ញុំមួយខែ 62000 ពេលខ្ញុំឈឺខ្ញុំទៅដេកពេទ្យអត់យកលុយទេអរគុណរដ្ឋាភិបាលដែលបង្កើតកម្មវិធីនេះខ្ញុំអរមែនទែនខ្ញុំសប្បាយមែនទែនខ្ញុំជាជនពិការបានសម្បត្តិនេះបានជួយខ្ញុំច្រើនណាស់ហើយបានដូចជាខ្ញុំទៅព្យាបាលនៅមន្ទីរពេទ្យណាក៏ដោយឲ្យទៅមន្ទីរពេទ្យរដ្ឋគេមិនយកថវិកាពីខ្ញុំទេខ្ញុំគ្រួសារងាយរងហានិភ័យខ្ញុំបានរាជរដ្ឋាភិបាលឲ្យខ្ញុំបានទៅពេទ្យព្យាបាលអត់អស់លុយខ្ញុំអរគុណរដ្ឋាភិបាលណានាំកូនមកចុះឈ្មោះទទួលអាហារូបករណ៍ពីរដ្ឋាភិបាលយើងសម្រាប់ខ្ញុំមានសេចក្តីរំភើបព្រោះនេះគឺជាឱកាសល្អដែរដែលរដ្ឋាភិបាលបានឱកាសសមាជិកជាជនក្រីក្រទាំងអស់មានទទួលបានថវិកាសម្រាប់អាហារូបករណ៍របស់កូនៗដែរសូមអរគុណដល់រដ្ឋាភិបាលដែលបានជួយដល់ប្រជាពលរដ្ឋនិងដល់ចៅខ្ញុំដែលបានឧបត្ថម្ភសាច់ប្រាក់ចៅខំប្រឹងរៀនតទៅទៀតចាដើម្បីអនាគតទៅមុខទៀតឲ្យជាកូនសិស្សល្អជាគំរូល្អដល់ប្រទេសជាតិបាទសូមអរគុណដល់រដ្ឋាភិបាលដែលបាន
กดกองได้สาสานสะได้มีบันสมพออ้อยมีจำนายจำเนียให้บันเลยกะทำใบกดกองเทียบเทียบของการเรียนเทียบ
ย้ำบ้านกรดหนักการนี้ให้ย้ำกับบ้านปลาเปิดปอสสได้ครับประหยัดบ้านเป็นปอสสบ้านโดยเทียบไปเด็กย้ำเติมเป็ดย้ำมันบัดจำบัดปลาทำต่อคล้วนให้แรงเป็นเทียบไปเด็กย้ำยันเตยปัวย้ำก็อาจปลาปอสสนั่งเตยเทียบบ้านลำตีเป็ดหรือก็ย้ำเตยสำราญต้นแต่มันไปกับถักการคล้วนไอ้
กับใครจงเชียร์แต่จะยืนจนโจนิวอดสมัยชมชื่อสกัดยุบคนลูกไอ้แต่เป็นตีเป็ดเอาเอาลุยทีบาดชมออกคนดอรีรอทาไปบ้าเลย
សម្ដេចមហាបវរធិបតីហ៊ុនម៉ាណែតនាយករដ្ឋមន្ត្រីនៃប្រជាណាចក្រកម្ពុជាជាទីគោរពដ៏ខ្ពង់ខ្ពស់បំផុត
Minister of the Kingdom of
ឯកឧត្តម
Cambodia,
លោកជំទាវ
Excellencies, members of the National Assembly and the Royal Government, Excellencies, ambassadors, representative of development partners,
ទាវ
Excellencies,
លោកស្រី
Oknyas, ladies and gentlemen.
ជាកិច្ចចាប់ផ្ដើមក្នុងនាមក្រុមប្រឹក្សាជាតិក្រមពេលសង្គម
First and foremost, on behalf of the National Social Protection Council and on my own behalf, I would like to express my deepest welcome and gratitude for the noble presence of Samdech Mahabawar Thappadei Hun Manet, Prime Minister of the Kingdom of Cambodia, who has taken time from his busy schedule to preside over this opening ceremony of Cambodia Social Protection 2025 of the National Social Protection Policy Framework 2024-2035. I would also like to extend a warm welcome to Excellencies, members of the National Assembly, the Royal Government, ambassadors, representative of relevant ministries, institutions, governors of the Board of Governors of capital provinces, national and international both here in persons and online. Samdech Mahabawar Thappadei, Prime Minister, distinguished guests and participants. Since 2022, the National Social Protection Council has organized Cambodia Social Protection Week annually. The Social Protection Week is a platform that provides opportunities for stakeholders to discuss and exchange perspectives, policies, share knowledge, experiences and practices, social protection policies from various countries, both regionally and globally, especially to disseminate the progress of Cambodia's social protection system to beneficiaries and the public for better well-informed. For 2025, we are all highly honored and proud that Samdech Mahabawar Thappadei Hun Manet, Prime Minister of the Kingdom of Cambodia, has honored us by presiding over the opening ceremony of Cambodia Social Protection Week 2025 and the official launch of the National Social Protection Policy Framework 2024-2035. This new phase of the National Social Protection Policy Framework has transformed the approach to a social protection system development from a pillar-based system to a life cycle risk approach, meaning it provides protection to citizens from the moment of conception in the mother's womb until the final stage of their life cycle. The two-day Cambodia Social Protection Week 2025 is organized under the theme Developing Cambodia's Social Protection System through life cycle risk approach for better coverage, and features keynote presentations, plenary discussions, group discussions, and youth debate competition on related topics, with participations from the honorable dignitaries, distinguished guests who are leaders of relevant ministry institutions, governors of the boards of governors of capital provinces, ambassadors, representatives of development partners, research institutions, students, and beneficiaries, totaling approximately 1,000 participants, both in person and via online platform. Prime Minister, distinguished guests, with your indulgence, I would like to take this special opportunities to report to Samdech Mahabubothapadai, Prime Minister, and the entire ceremony about the progress and key achievements of the development social protection system during the implementation phase of the National Social Protection Policy Framework 2016-2025 into two parts. Number one, system building, and number two, the introduction and the expansions of social protection system coverage, including national social assistance programs, social security schemes, and shock responsive interventions. Part 1, system building. To build a robust, resilient, and efficient social protection system, the royal government has developed and issued legal instruments, framework documents, roadmaps, strategies, and key guidelines for institutionalization, as well as for promoting the implementations of various national social assistance programs and social security schemes. Additionally, institutional mechanism in the social protection system has been strengthened to efficiency, transparency, programs, populations. Furthermore, the royal government has also established a digital social protection system to increase efficiency, effectiveness, and to facilitate the operations of various programs and schemes in the protection system, as well as implement a monitoring evaluation mechanism to track implementation progress and make a timely adjustment. This work has been considered crucial by the royal government for the 7 legislatures of the National Assembly in measuring the effectiveness and results of the policies introduced. This system building has provided a solid foundation and served as an important catalyst in the subsequent introduction and expansions of a social protection system coverage, which has received public acclaim based on the approach strengthening systems to expand coverage. Part 2. Introduction and expansions of social protection system coverage. Since 2017, the Royal Government has achieved numerous accomplishments in the implementations and development of a social protection system to provide protection to citizens through expanding existing national social assistance programs and social security schemes and launching new social assistance programs and social security schemes successfully in 2 aspects. Number 1, social assistance. As of the end of 2024, there were 8 national social assistance programs covering a total of 1.2 million households with over 4.8 million members, equivalent to approximately 28% of the total population, with a state budget expenditure of 1,140 billion reals, equivalent to approximately $285 million for 2024. The Royal Government has expanded the coverage of existing social assistance programs, including the Health Equity Fund to vulnerable groups and at-risk families, as well as launched new programs such as the National Social Assistance Program for Vocational Training and the National Social Assistance Program for Family Package to continue supporting target households' livelihoods and provide opportunities for them to stay on track for poverty graduation. Number 2, social security. As of the end of 2024, there were 3 major social security schemes covering approximately 2.7 million citizens, both in public and private sectors, with total expenditure of approximately 2,297 billion reals, equivalent to about $574 million, including a state budget of $406 million and contribution budget of approximately $168 million per annum. These social security schemes include healthcare, social security schemes for workers, civil servants, former civil servants, and veterans, self-employed, and dependents of NSSF members. Number 2, employment injury schemes for workers and civil servants. And number 3, pension scheme for workers, former civil servants, and veterans. Moreover, during past crises and shocks, including COVID-19 pandemic, inflationary pressures, and severe flooding, the Royal Government also considered and provided protection to citizens through special social assistance interventions for poor and vulnerable households, spending additional state budget totaling 5.7 trillion reals, equivalent to approximately $1,422 million to effectively help maintain livelihood stability, reduce negative impacts, and restore citizens' livelihoods. Overall, since the implementations of the National Social Protection Policy Framework 2016-2025, Cambodia's social protection system coverage has more than doubled, with population coverage increasing from 3.3 million people in 2017 to over 7.5 million people in 2024. Samdech Mahabawar Thapadai, Prime Minister, distinguished guests and participants, for the next phase, to ensure sustainability of the continued development of Cambodia's social protection system to be more robust and advanced for the next 11 years, the National Social Protection Council has updated the National Social Protection Policy Framework 2016-2025 to become the National Social Protection Policy Framework 2024-2035, incorporating results from the midterm evaluation of the implementations of the National Social Protection Policy Framework 2016-2025 and inputs received from ministries, institutions, development partners, employers and employees, representatives, civil society organizations and stakeholders through multiple technical meetings, consultation meetings, and public consultation workshops. I would like to emphasize again that this new phase of the National Social Protection Policy Framework has shifted from a pillar-based social protection system development approach to a life cycle risk-based social protection system development and protection provisions approach covering 7 life cycle risks, including maternity and childhood risk, health risk, employment risk, disability, unemployment, homelessness, and old age and survivorship, defining directions of social protection intervention for each stage, as well as determining policy measures for related cross-sectoral work to help promote development and ensure no obstacles to the social protection system development both directly and indirectly. I would like to take this opportunity to express my deepest gratitude to relevant ministry, institutions of the government, development partners, and all stakeholders who have paid attention and provided excellent cooperation in the preparations of the National Social Protection Policy Framework 2024-2035, which Samdech Mahabawar Thapadai, Prime Minister, will officially launch in a moment. Samdech Mahabawar Thapadai, Prime Minister, distinguished guests and participants, as the chair of the National Social Protection Council and on behalf of all Cambodian citizens, I would like to express my deepest gratitude to Samdech Akek Maha Senabadai Dacho Hun Sen, former Prime Minister and current President of the Senate, for initiating, leading, and promoting the development of Cambodia's social protection system with vigor, agilities, and long-term vision. Additionally, I would like to express my highest gratitude to Samdech Mahabawar Thapadai Hun Manet, Prime Minister of the Kingdom of Cambodia, who has dedicated his physical and mental strength and intellectual spirit in continuing to lead the country by maintaining high attention to citizens' welfare and prosperity, and has determined resolutely to continue promoting the development of Cambodia's social protection vessel to be more robust and continue moving forward sustainably towards achieving Cambodia Vision 2050 under the cool shade of peace throughout the country. As the chair of the National Social Protection Council, I would like to commit to cooperate with all relevant ministries, institutions to continue building and reforming the social protection system to expand coverage better for the benefit of all Cambodian citizens. Furthermore, as the Minister of Economy and Finance, I will continue to strive to strengthen revenue collections, strengthen spending efficiency, increase physical space, and increase national budget savings to serve all rural government policies, including this new phase of the National Social Protection Policy Framework to expand coverage better according to life cycle risk. Before concluding, once again, I would like to express my deepest gratitude to Samdech Mahabubor Tepadei, Prime Minister, for honoring us with his presence to preside over the opening ceremony of the Social Protection 2025 and the official launch of the National Social Framework 2024-2024. I would like to wish Samdech Mahabubor Tepadei, Prime Minister, Excellency Ognias, ladies and gentlemen, all members of the ceremony, therefore, Buddha blessings, longevity, nobility, health, and strength. To proceed with the highest respect, I would like to invite Samdech Mahabubor Tepadei Manet, Prime Minister of the Kingdom of Cambodia, to deliver the keynote speech and provide recommendations to the entire assembly. Thank you very much.
Members of the National Assembly and the Royal Government of Cambodia, Excellency diplomat, ambassadors representing in Cambodia, Excellencies, distinguished national and international guests, ladies and gentlemen, it is my great pleasure to preside over the opening ceremony of the Cambodia Social Protection Week 2025 and the official launch of the National Social Protection Policy Framework 2024-2035 today. I would like to extend a warm welcome to Excellencies, members of the Senate, National Assembly, Royal Government of Cambodia, diplomats, development partners, and all national and international distinguished guests present here at this event. Excellency, ladies and gentlemen, the Cambodia Social Protection Week is an important annual event of the National Social Protection Council. This event opens the opportunities for dialogues, exchange of views, knowledge, and best practices between stakeholders, especially to inform the public as well as the beneficiaries about the benefits that citizens should receive from the social protection system in Cambodia. I would like to emphasize that this dissemination event is very important, and one of the priority activities of the Royal Government is to raise public awareness, particularly the target citizens, about the social protection benefits that the Royal Government of Cambodia provides and the efforts of relevant ministries and institutions at both national and subnational levels in providing the benefits to our citizens. And in this regard, I would like to encourage the National Social Protection Council to continue organizing the Cambodia Social Protection Week in the following year by initiating a wider discussion and dissemination of social protection system in Cambodia at the regional level. And the relevant ministries and institutions must provide stronger cooperations to jointly achieve the 3 policy priorities related to social protection system among the 6 policy priorities of the RGCs of the 7th legislature of the National Assembly. Excellencies, ladies and gentlemen, the main policy priority of the government in every legislature of the National Assembly is to maintain peace and political stability, which are the prerequisites for the economic growth and national development. For instance, Cambodia has achieved and continued to benefit from peace, political and macroeconomic stabilities, which allowed Cambodia to maintain an average economic growth rate of approximately 6% over the past decade, despite the negative impacts of the COVID-19 pandemic and other crises. This sustained growth has transformed Cambodia into a lower middle income country since 2015. The fruit of this economic growth have been distributed equitably through the investments in health, education, and particularly in the social protection system. The government recognizes that these investments have significantly contributed to building a fair, peaceful society and laying the foundation for the country's development. As a result, GDP per capita has increased nearly 9 times, from approximately $310 in 2000 to approximately $2,713 in 2024, while the poverty rate has consistently declined, which is worth noting. In overall, the fruits of economic growth, full peacefulness, and political stability are indispensable prerequisites that enable the rollout and implementation of key policies and strategies, as well as successful implementation of important reforms to restore and develop the country, achieving commendable results. The RGC has implemented the National Social Protection Policy Framework 2016-2025, which has played a significant role in building and developing social protection system to ensure stability, effectiveness, sustainability, and inclusiveness as it stands today. Excellencies, ladies and gentlemen, as reported by His Excellency Cabinet Secretary and Deputy Prime Minister, Minister of Economy and Finance, Chairman of the NSP Council, through the implementation of National Social Protection Policy Framework 2016-2025, Cambodia's social protection system has made significant progress and achieved notable results. These results are clear demonstration the implementation of priority by the sub-legislature of the Assembly. The 3 priority programs related to the social protection system are outlined in the first phase of the Pentagonal strategy, including first priority policy program, which is providing healthcare towards universal health coverage. The second priority policy program, providing vocational and technical training for youth from poor households and at-risk households throughout the country, which is one of the national social assistance programs. The third priority policy programs, institutionalizing the national social assistance programs for poor households, vulnerable groups, in poor households and at-risk households during economic crisis and shocks. These 3 priority policy programs have contributed to which we think about 50% is not by chance, which is reflecting the attention paid by the government, not only Cambodian government or any government. The main priority is for the people. If we talk about people, it's about health, safety, and livelihood. So all of these are important work which need to ensure that our country has a sustainable human resource contributing to economic development. Therefore, the Pentagonal Strategy Phase 1 focuses on these priority programs. These 3 policy programs have contributed to further expanding the social protection system. With this, I know that since the launch of the National Social Protection Policy Program Framework 2016-2025, the coverage of the system has doubled, covering more than 7.5 million people by the end of 2024, as outlined by Excellency's on Prime Minister's report, 3.3 million to 7.4, which is, we change the 3 digits, but each figure represents each person. If you just saw in the video clips, we interviewed just 6 or 7 people, so 1 million times then these will benefit as the same as those 6 or 7 people. This is reflecting the effective result where the previous governments have paid attention, not just the figure that we just saw, but each figure representing important stakeholder in promoting national development. Of course, the arrangement of this social protection system, when we heard about the social protection, it means the government has to spend, but our social protection system is for health, for vocational training, that is to train our people and support our people to have good health, good knowledge, and to find job in a sustainable way. And the social protection doesn't mean that the government spend all, but it increase the social protection safety net to be sustainable. The able system in employment with those able and unable to afford, the civil servants and those who work at institutions and private sector who are able to prepare the supporting system. Those who do not have ability to pay, especially those unemployed or at risk, are being paid attention by the government. As reported by Excellency Cabinet Superior, not just when they get the work, but when you just a baby in the tomb, for the mother with pregnancy until the child reaches 2 years old, and we expand the coverage, not just, even if those in the prison are entitled to this benefit. Mother may did the wrong doing, but the child, the baby does not. So we need to pay and take care and pay attention on them. This is what we have done in reality in assisting in ensuring the social welfare and success of our people, which is very important assets for the country. This coverage expansion has greatly contributed to improving the welfare and livelihoods of citizens, particularly the poor and the vulnerable, both in normal situation and shocks, by reducing poverty and strengthening human development and resilience of citizens. The main goal of developing the social protection system is to equitably distribute the benefits of economic growth, to reduce inequality and strengthen social cohesion. Those who are successful, we create a conducive environment for them. For those who are not able to afford, the government will consider in helping them. This is the socio-economic development. That means to reduce poverty. Poverty alleviation doesn't mean take out the poor people or until they die, no. That means we reduce poverty alleviation from high to lower rate. That means the previously poor people become in middle income or have better improved livelihoods. This is what we have paid attention. I used to visit Daminjay province when we issue the equity card. One family or household was poor, but a few years later, when the economic condition improved, they can afford to buy tractor. They could buy the ploughing machine. Those who do not understand, they say, why we help the rich? At the time we didn't update, because initially we helped the poor, but later on their livelihood improved. So now we updated the system with the request for assessment. So our duty not to have social protection so that people remain poor and depending on the government, but we help them during time of difficulties when they need the assistance. We need to help them to be strong in their livelihood. That is why there is some questions. I remember when I dispatched the medical team, they asked why we helped people in health sector, why not to teach them. They said to have this will not guarantee sustainability. That is why we need, they said, and we need to help them to catch the fish to ensure sustainability. But I said, while I see the fisherman is being sick, whether I give him the fishing net or a fishing rod or I give him medicine. So I need to ensure that he become healthy before going to fish. Therefore, we need to pay attention on protection, especially for those in need, so that they can have the ability to seize the opportunity to go on in their life. In the report by Excellency Manet, this does not cover only free medical care, but also the training and linking the ability to find jobs in order to raise income. This is what the fruits in poverty alleviation. Where have the poor been? Actually, after the win-win policy in 2000, the poverty rates reduced from 40% further down until COVID. They have not gone anywhere, but they become richer or improved in their livelihood from being very difficult or poor to a situation where they can generate decent incomes. Some even have a very good livelihood or income. These are the fruits of the assistance. The results and advancement have not happened by chance, but resulted from the dedicated efforts and close cooperation from all relevant ministry institutions, national and subnational levels. development partners, employers, workers, and civil society organizations. In this sense, I would like to take this opportunity to express my appreciation to all stakeholders who have actively contributed to the implementation of the National Social Protection Policy Framework 2016-2025. Excellency, ladies and gentlemen, on behalf of the Royal Government of Cambodia, I'd like to reaffirm to all Cambodian citizens that under my leadership, the government is committed to continue prioritizing the improvement of the citizens' welfare and living standard, human capital development and poverty reduction, taking on the leave no one behind approach. We will devote to steering the Cambodia social protection ship to move forward in an energetic, sustainable manner to achieve the long-term vision of transforming Cambodia into a high-income country by 2050. To achieve this goal, the Royal Government has developed and launched the National Social Protection Policy Framework 2024-2035 with a long-term vision to provide support to citizens against income insecurity at each stage of life, focusing on promoting health and welfare, reducing poverty, gender inequality, and social inequality, and strengthening social solidarity, stability, and equity. The NSPPF 2024-2035 will be the guise replacing the current NSPPF 2016-2025 to ensure the sustainability of the development of social protection system in Cambodia for the next 11 years, which reflects the Royal Government's commitment to providing policy direction in order to continue providing income security to citizens through the life cycle risk, in alignment with the Pentagonal Strategy Phase 1 of the Royal Government of the 7th Legislature of the National Assembly. Excellency, ladies and gentlemen, in the context of changing the geopolitical conditions both locally and globally, as well as the increasing global challenges such as public health crisis, natural disasters, and climate change, I believe that the role of social protection system is increasingly critical and indispensable in contributing to maintaining the livelihoods and providing better protection for our people. In this regard, the official launch of the National Social Protection Policy Framework 2024-2035, being updated version of the National Social Protection Policy Framework 2016-2025, will further offer the improved protection of Cambodian citizens through the new approach called life cycle risk approach, which the citizens will be provided protection from birth until the final stages of life, covering 7 life cycle risks, which include the following. First, maternity and childhood risk. Second, health risk. Third, occupational risk. Fourth, disability. Fifth, unemployment. Sixth, homelessness. And 7, old age and survivorship. I strongly believe that the National Social Protection Policy Framework 2024-2035 will contribute to enhancing the living standards and quality of life of all Cambodian citizens and contribute to strengthening social solidarity, resilience, and social stability. Excellencies, ladies and gentlemen, as the social protection system continues to expand, and with the purpose of ensuring the financial and system sustainability, the government sets out the common principle in managing national social protection system, in which every citizen is obliged to pay contributions in order to receive protection However, the government also focuses on protecting the poor, vulnerable and at-risk citizens who are unable to have or have limited capacity to pay the contribution, while carefully considering the affordability of the national budget, as well as the exit strategy through the opportunities to access to education, skills training, and decent work. In addition, to continue reforming and developing the social protection system for further development, as well as outlined in the new policy framework, the government will adhere to 7 main guiding principles. 1. Ensuring the equity and inclusiveness in social protection system. 2. Considering the adequacy and appropriateness of benefit packages. 3. Ensuring affordability of the national budget and financial sustainability. 4. Ensuring the effectiveness of the management and delivery of national and social assistance programs and social security schemes. 5. Maintaining the flexibility responsive to external changes and developments. 6. Maintaining the good governance in the social protection system. And 7. Gender responsiveness. Furthermore, this policy framework also outlines key priority measures for cross-sectoral collaboration to support the development process and ensure to prevent the development of social protection system from both direct and indirect obstacles that may hinder. Furthermore, to ensure the successful implementation and check and balance system, a check and balance between functions with the social protection system, the government continues to establish the governance structure of the entire social protection system in accordance with the 3-level structure, which includes the National Social Protection Council at the policy level, which has the function of strategically guiding the high-level policy direction. Social Security Regulator at the regulatory level, responsible for monitoring and supervising all social security operations, and National Social Security Fund, National Social Assistance Fund, Health Equity Fund, National Payment Certification Agency, and subnational administration institutions, which operate directly as the operator and implementing agencies. This new policy framework also sets out priorities to strengthen the governance of social protection system across these 3 levels. Excellencies, ladies and gentlemen, on behalf of the Royal Government, I'd like to express my admiration and appreciation for the efforts of the National Social Protection Council, led by Excellency the Honorable Deputy Prime Minister, Minister of Economy and Finance, who has spearheaded the development and coordination of the National Social Protection Policy Framework 2024-2035, which will be launched today. I would also like to extend my gratitude to all relevant ministry institutions, civil society organizations for their support and cooperation in preparing this and formulating process to ensure successful implementation of this new phase national policy protection, social protection policy framework, and achieve good outcome. I entrust on the Prime Minister, Minister of Economy and Finance, and Chairman of the National Social Protection Council to continue leading, guiding, and coordinating with effectiveness. At the same time, the National Social Protection Council, having the General Secretariat of NSPC as the supporting body, shall continue to develop the action plan to implement this policy framework appropriately, timely, and in alignment with the set policy objective to ensure achievement of this desired outcome. In line with these, and in order to achieve the vision of the policy direction set out by the government and continue development and strengthening the social protection system in Cambodia, especially to promote the successful implementation of the NSPPF 2024-2035, I'd like to offer the following recommendations. First, the Ministry of Health must ensure that citizens, including those with equity cards, at-risk household cards, and SSF cards have timely access to essential healthcare services to support prevent any barriers and could negatively impact the implementation of the rural government's policy. Moving forward, the universal health coverage in Cambodia. And in this regard, I would like to encourage citizens to report any cases where healthcare providers fail to offer proper attention when using any of the aforementioned cards to access healthcare services. In this regard, I task Excellency Minister of Health, Minister of Labor and Vocational Training, and Minister of MEF the price of the social protection is now about the money we spend, the price, what we offer to the people, the value, that's what I mean. So it is very important. It's about the quality of service, both the equipment, the medicines, and the results, where we need to strengthen the healthcare center and referral hospitals at district and provincial level, plus the responsibility of the private sectors. Secondly, the ethics, work ethics. For those NSF card officials, we need to prevent any discrimination. For private sector, you need to also follow the approaches, the work ethics. That means we cannot discriminate whether people have or do not have money, and we cannot discriminate between those who pay money by themselves and those who are using the cards. We need to ensure people are being pure equally. These are the values, not just how big the package is, but the value is to receive service in a timely manner with care, and they will be pure with good health. These are the priorities that we need to pay attention. Second, the National Social Assistance Fund, which is the sole operator of social assistance system, must strengthen the mechanism for delivering social protection benefits to beneficiaries, address related challenges promptly, and expand average efforts to ensure the public, especially citizens, fully understand the benefits of the government's national social assistance programs. On these works, we need to strengthen governance, which is very important. The loyalty from all stakeholders. The NSSF have paid good attention on this, and I request all public and private stakeholders, please, you need to participate well, because this budget is for helping the people, so we need to have transparency. We need to be strictly implement this to avoid any misuse of the fund, because this fund is supposed to help the need. And if the partners did not implement in the right way, we need to implement very strict measure to counter these irregularities, because every dollar is for every citizen, for every female, every child. The participation from private sector is very crucial too. Initially we started with the public institutions, but that was not enough coverage. That's why we expand the coverage, and we welcome in this process. So the good governance with transparency to ensure sustainability of the budget, right at the target, both private or public institutions, we need to ensure the effectiveness. So I urge all relevant stakeholders to adhere to good ethics and transparency and integrity to ensure our assistance to the people are sustainable. These are very important work. Third, the Ministry of Planning and Ministry of Interior, through sub-national administrations, municipality, provincial level, district level, commune, Sankat levels, must ensure that the identification process are carried out effectively, accurately, and promptly, and that regular updates and registration of target citizens are conducted to avoid any lapses in receiving social protection benefits due to expired or unissued equity funds, equity cards. Related to this point, I would like to emphasize that relevant working group must ensure that those receiving equity or at-risk household card are indeed citizens facing real hardship, to avoid criticism that the issuance of such cards are unfair. Additionally, the sub-national administration must collaborate closely with relevant ministries and institutions to ensure the effective and timely implementation of the national social system programs and social security schemes. We need to be responsible for especially the payment system, so that we have circulated current of the payment. This is our goal. For example, a clinic which is participating with this system is not taking 2 or 3 years. We need to pay on time so that they can refill in their needs. This is a very dynamic system which needs to ensure timeliness and effectiveness to ensure the good quality service. We need to create conducive environment or conditions, especially for the accurate payment system. So all stakeholders, all actors, those who supplier need to be accurate, and the governments need to ensure our responsibility to tackle the issues, to avoid lapses and blaming each other, to ensure the beneficiary receive the benefits. So both private sector and public sectors and ministry need to ensure a very smooth system. We need to have each other, so that we need to make our house in order so that we can provide good quality services. The house, including private and service and private and public sectors, and the other operating agencies. So this is what I would like to all of you to pay attention, and we need to have constant assessment on the process. We need to help each other, jointly help the people. This is our target, our goal, to ensure our target being met, to ensure people having trust and warmth in our system, because we spend our own money. When we prepared the national budget the other day, we see the expenditure and the revenue. We received some criticism. They said the state running out of budget, out of money. They said the budget is too big. You see, this is because the increase in population and the improved livelihood of the people and the increase in payrolls of civil servants. But the fast increase in expenditure is the social assistance. We need more assistance to the people, not to increase expenditure to buy warship or fighter jets. We spend money for the people. That is why our national budget increases. we have our civil servants and our armed servicemen, women. The increase in public infrastructure for the people. There is a lower revenue. Why? Because our economy is not functioning well as before COVID. Now, another thing, at this situation, we're also providing tax incentives more for, promoting the private sector, even if the private university also ask for incentives. And agricultural sector also we provide assistance, incentive, including tourism sector. However, we are still under control. The other day, Ministry of Social Affairs, when they acted, they paid a little bit late, maybe in the second payment of the month. That was 1 week late. That the government is running out of money. I would like to emphasize that the state doesn't run out of money, but we prepared to last year. We are even able to increase salary for the civil servants and increase budget for social protection system to the people. And it's not going to be late payment. So please, our citizens have confidence in the state. Not just salary for the veterans or any bonus for our civil servants, 50,000 real for each official. All will not be removed. So the budget, national budget management is very clear, very transparent. But the deficit between income and the revenue and the expenditure is not for Cambodia, but we need to ensure that we can cover the current expenditure, the investment, and especially our attention to help people during time of hardship. We need to expand the targets actually. When we reform our system, we increase the coverage up to 7.5 million beneficiaries, and each system we need to strengthen to ensure it is workable, and we also provide more incentives, which leads to a reduction in revenue. For example, when we want to help the tourism sector, the government agrees to reduce $4 visa. So in 1 million tourists, we would reduce $4 million US. We lose it. And for visa application, 5 or 6 million people will lose more money. But anyway, we will reduce this, but we can increase the tourist arrival. For example, the export of the cutting stone, we waive the export fee. So when they said the revenue is reduced, the expenditure increase, is not we are careless, but we find a way to manage it. We also manage the unnecessary, the spending, the new recruits for government salary. We only allow for priority sector, for example, health, education. For other ministerial institutions, we do not allow for new recruits. National defense, national securities, we provide more permissions to recruit more officials or staff. If we don't have policemen at the commune levels, it's not good. So the expenditure in the budget management, we need to be transparent, especially we pay attention on the hardship of the people during the economic downturn period or any difficult times. We need to sustain assistance for them. Budget related to assisting people is not reduced. For example, helping pregnant women, we keep the same level. We don't cut the salary for veterans or government officials, or but we reduce some unnecessary expenditure. We need to ensure the efficiency in our works. I saw 3 requests the other day. Ministry of Public Works and Transport asked for the building of a $50 million road, and Ministry of Industry requests $60 million for clean water system. Ministry of Health requested additional $20 million for improving the capacity of referral hospitals for the operation and surgery at the emergency level. So totally about $130 million, but we cannot afford to pay all at once. So in 3 expenditures, I told Cambodian to delay that road repairs, but the most important thing is the referral hospital. We need to strengthen our medical staff capacity to ensure that they can perform the surgery during time of emergency case. Minister of Health said sometimes we have doctors, but we don't have enough facilities, or we don't have enough equipment. The room is not fully equipped. We don't have laboratories for blood tests. Then that patient need to be dispatched to the provincial level, and some hospital at the provincial level. They're not far away, but some provinces it's far away. It takes hours. Therefore, we need to allow for that. And on clean water, it must be prioritized. We need to provide more clean water access to the people to reduce our health risk. Therefore, we need to make decision. First is for ICU at the referral hospital, because this is relating to saving life of the people. The second priority is the clean water. We allocated into 3 stages, and the third priority is the 20-kilometer road repair. Therefore, you need to repair at your own ability. The road can be paved, although it's not good, but priority is clean water and the ICU. These are the priorities where the government have taken. That means we prioritize the health and welfare of the people. This is the most important target when we need to intervene, helping finance for the people or tax policy. We need to offer incentive. We also have some financial policy with some assurances. So in return, we see that health, the people's living standard, livelihood, and the people's happiness is still the priority, remains the priority of the government. This is not just lip service, but we do it in reality. We just talk about what we have done, not just what we will do. The launch of the Social Protection Week is not about what we will do, but actually 7.5 million people already benefited from this since 2017, and we will continue to do more. This is what we have done for the people. For the talker, and they just talk, but for us we do it to provide real service to the people. We don't have time to talk in a fantasy way. We focus on the real result, and this is our obligation because the people have given trust to the CPP to lead the country. We need to keep our promise. And another thing is our policy. I met with some countries' leaders. Their policy cannot be passed because government have changed from time to time. One government issue one policy, the implementation is not yet done, but another leader comes up to office. For example, for insurance, for health insurance, it took more than 2 or 3 presidents to implement because the new one come in, they just remove it. So the social protection system is there, is not there through different presidencies. But of course, with Cambodia, we changed the prime minister from Samdech to me, but our policy is not changed. For other parties to lead the country, I don't know whether they continue our policy. They may dissolve our policy, but for us, the royal government led by the CPP, the policy launched in 2000, now until 2035 we will ensure sustainability. And we have trust and confidence that the CPP will lead the country in the long run because we do help people in reality. Why the government talks about the political party? Any country, the ruling party lead the countries, and the government implement the ruling party's policy to serve the people's interests and promise. So as long as CPP still remain in power, we will implement this policy, this roadmap, this mechanism without instability. We will not remove any policy without implementation. So I would urge the people to keep their trust and confidence in the government, and the government will continue implementing this policy. From 2017, we increased from 3.3 to 7.5 million coverage. We have the target of universal health coverage. That means every citizen in the future, under the implementation of policy, will be benefited from these policies. The political stability is very important. Whether big or small countries, without stability, political stability, we cannot do anything. Number one, political stability. Insecurity or war is one issue, but political stability is very important. Policy stabilization is very important. We need to be consistent. In some countries, the leader can have only one mandate. But policy cannot be implemented overnight. It needs some time to prepare. So I don't mention any country. They just launch the policy, then a new leader come to office, then they just remove it because the new one doesn't follow with the old one, because that might credit the previous leader. They just delete it, and it creates uncertainty. They will, if you delete or remove that policy, that means no more budget for that. So sustainability of policy is very important, and our policy is not for 2028 but until 2035. It's a long-term one, so it's 11 years. We need to expand health services, so from step by step we will ensure the effectiveness and sustainability. The social protection system is for the hardship or for time when people in hardship. We have an SSF cards, not just for when we are in good health, but for when we are sick or having job incident or accidents. So we have this fund to help people during time of difficulties. So when we are in good time, we need to prepare for things which may happen in a bad time. So social protection system will help complement with the state budget from private sector, from public sector for an SSF fund, and so we work together. So the guarantee of policy stability and implementation mechanism is very crucial. 5. The Social Security regulator must continue to strengthen the institutional capacity to implement and monitor Social Security operation effectively, ensuring the sustainability and financial soundness of the Social Security Fund, which guarantees full rights and benefits for members in the long term. 6. National Payment Certification Agency, a part of National Social Protection Council, must ensure the transparency of payment verification across health services providers under the social protection system nationwide by collaborating closely with the Ministry of Health as necessary and in timely manner. 7. The General Secretariat of the National Social Protection Council must enhance its coordination of policy implementation and the monitoring and evaluation of the National Social Assistance Program and Social Security schemes to ensure that no one left behind due to negligence. Through this monitoring and evaluation process, the National Social Protection Council must regularly monitor the process and challenges to take into account and implement necessary related policies in a timely manner. Last but not least, I wish you all success in the four blessings of living well, health and strengthen, and you may continue to achieve new success in serving the nation under the shelter of peace and stability. I now officially declare the opening of Cambodia Social Protection Week 2025 under the theme Developing Social Protection in Cambodia for better coverage through life cycle risk, and formally announce the official launch of the National Social Protection Policy Framework 2024-2035 from now on. Thank you.
Your Excellency, ladies and gentlemen, I would like to extend my gratitude to Samdech Prime Minister Ladies and gentlemen, a big round of applause, please. Next, Samdech Theppaday, Prime Minister of the Kingdom of Cambodia, will hand over the National Social Protection Policy Framework to His Excellency Cabinet Secretary, Deputy Prime Minister, Minister of Economies and Finance. Ladies and gentlemen, a big round of applause, please. Next is the departure of Samdech
Thank you for
Theppaday,
staying with
Prime
us
Minister.
throughout this pivotal event. We've witnessed a remarkable gathering today at the Soka Hotel for the opening ceremony of Cambodia's Social Protection Week 2025, along with the official launch of the National Social Protection Policy Framework 2024 to 2035. A key highlight of today's event was the address by Prime Minister Samdech Manet. His remarks not only underscored the government's commitment to social protection, but also outlined a comprehensive vision for the future of welfare in Cambodia. He emphasized social protection is not just a government responsibility.